Hey there, welcome back. As May 2025 brings warmer days and longer evenings, over 70 million Americans are gearing up for their Social Security payments. But here is the kicker. Could your entire Social Security check be at risk this month due to a new overpayment rule? From payment schedules to game-changing policies and Medicare updates, these changes could reshape your financial plans. Whether you're budgeting, paying bills, or just staying informed, we've got the clear, actionable insights you need. Let's dive into the must-know updates for May 2025. Let ES kick things off with the Social Security payment schedule for May 2025. Your payment date depends on your benefit type and birth date. Here's the full breakdown. Let ES start with when your Social Security payment hits in June 2025. Your payment date depends on your benefit type and birth date. In June 2025, SSI recipients will receive their payment on Monday, June 2nd, as June 1st falls on a Sunday. Those receiving both SSI and Social Security, or whose benefits started before May 1997, will get paid on Tuesday, June 3rd. Other Social Security beneficiaries. Payment dates depend on their birth date. Those born between the 1st and 10th will receive payments on Wednesday, June 11th. Those born between the 11th and 20th on Wednesday, June 18th, and those born between the 21st and 31st on Wednesday, June 25th. Keynote: SSI recipients will get their June payment early on May 30th, 2025, Friday, as June 1st is a Sunday, meaning 2 SSI payments in May. If you use direct deposit, funds typically hit your account early in the day. Paper check users should expect potential mail delays. Always verify your deposit to ensure accuracy, especially with recent policy changes. One of the biggest updates this year is the Social Security Fairness Act, signed into law on January 5, 2025. This law repealed the Windfall Elimination Provision, WEP, and Government Pension Offset, GPO, which had reduced benefits for over 3.2 million public sector retirees, including teachers, firefighters, police officers, and federal employees. Social Security Fairness Act. Retroactive payments: the SSA has distributed over $14.8 billion in back payments to more than 2.2 million beneficiaries, with an average lump sum of $6,610 by April 2025. Increased monthly benefits: most affected beneficiaries saw higher monthly payments starting April 2025 for March 2025 benefits. If you're among those affected, check your May deposit to confirm your increased payment or back payment has arrived. This is a long overdue victory, but not all public employees qualify. Only those with non-covered pensions benefit. On the flip side, a new overpayment recovery policy effective March 27, 2025 could pose challenges. If the SSA determines you've been overpaid, whether due to their error or yours, they can now withhold 100% of your monthly check until the overpayment is recovered, a sharp increase from the previous 10% cap overpayment recovery. This change, expected to save $7 billion over a decade, has sparked concern among senior advocacy groups for its potential to cause financial hardship. If you receive an overpayment notice, act fast, request a waiver. If the overpayment wasn't your fault, you may qualify for a waiver. File an appeal. Contest the decision if you believe it's incorrect. Set up a payment plan. Spread out repayments to ease the burden. The window to respond is short, so don't delay to avoid losing your entire benefit. The Social Security Administration is undergoing a major overhaul led by the Department of Government Efficiency, DOGE, aiming to modernize systems and save $800 million annually. Key changes include enhanced fraud prevention. Since April 14, 2025, all claim types can be filed via phone with new anti-fraud tools. Suspicious activity may require in-person identity proofing. Fraud prevention. Staff and office cuts. Plans to lay off 7,000 workers and close 25 offices have raised concerns about service access. SSA changes. System upgrades, replacing outdated COBOL systems, but experts like former SSA Deputy Commissioner Jason Fishner warn of potential benefit disruptions. A federal judge recently blocked DOGE from accessing private SSA data, citing Privacy Act violations, slowing some reforms but not all. If you face delays or issues with SSA services, these changes might be the cause. Medicare changes for 2025 are critical for seniors. Medicare premiums. Part D out-of-pocket. Cap, Since January 1, 2025, Part D plans cap out-of-pocket drug costs at $2,000 annually, a major relief for high prescription expenses thanks to the Inflation Reduction Act Medicare changes. Premium and deductible increases. Part B premiums rose to $185 monthly from $174 or $70. Part A inpatient hospital deductible increased to $1,632 per benefit period from $1,600. Hospital coinsurance for days 61-90 is $408 daily, and skilled nursing facility coinsurance for days 21-100 is $209.50 daily. The drug cost cap is a win, but rising premiums may offset savings. Review your Medicare plan to ensure it meets your needs. The 2.5% cost of living adjustment, COLA, for 2025, effective since January, increased the average retirement benefit by about $50 monthly from $1,127 to $1,176 Social Security changes. However, with rising costs for food, gas, and rent, many seniors feel this adjustment falls short. Revisit your budget to ensure your benefits cover essentials. Starting May 5, 2025, student loan collections resumed, including garnishments from Social Security benefits for borrowers in default, sparking debate among senior advocacy groups. Overpayment policy. If affected, contact your loan servicer to explore repayment options or deferment. To stay ahead this month, follow these steps. Check deposits. Verify your May payment, especially for Fairness Act increases. Monitor notices, watch for overpayment or SSA communications. Update accounts, keep your SSA account and direct deposit details current. Plan for delays. Anticipate potential SSA service disruptions. Review Medicare. Leverage the drug cost cap but budget for higher premiums. Share your experiences in the comments below. Your insights can help others navigate these changes.